Good morning, Coastal Bend. It is 6:24 on the clock, and February is American Heart Month, which is a time to focus on the health of one of our body's most important organs. Heart disease remains the leading cause of death here in the United States, but many cases are preventable. Joining us this morning, we've got a very special guest from CHRISTUS Spohn Shoreline to talk about heart health, warning signs to watch for, and simple steps to take to protect yourself. Good morning, Dr. Cunley. How are you doing?
I'm doing very well. How are you?
Good. Thank you so much for being up bright and early with First Edition. But we are talking about something very important. But first, tell us a little bit about yourself and why heart health and cardiology is so important to you.
Yeah, absolutely. My mother is a nurse, and from the very early young age, I was introduced to healthcare. She cared for a lot of people. This is the beginning of my healthcare endeavor. With regards to why it's important to be concerned about your health, especially your heart health, like rightly said, as part of your introduction, it's a leading cause of death. It is important that we are aware of what goes on within our body. People should be aware of chest pain, shortness of breath, getting tired easily. These are the early signs of heart failure or heart disease.
Thank you so much for pointing out some of those symptoms or things to keep an eye on. You know, we focus a lot about, women's heart health. It can be a -- 1 killer in them, but men as well. Talk about how heart disease doesn't discriminate.
Yeah, absolutely. We have inherent risk. Depending on what our family history is. So if you have a family history where people have prior episode of heart attacks, they have high blood pressure, they have diabetes, these are the telltale signs that you may be at risk for heart failure or heart attack. The things that you should look out for, like I said earlier, are you getting tired easily? Are you having shortness of breath? Are you having like swelling of the ankles and things like that? Those are the early telltale sign of heart disease. And it doesn't discriminate whether you're a man or whether you're a woman. Yeah, absolutely.
Lastly, for our viewers who are watching this morning, if you had one tip for them to start improving their heart health today, what would you tell them?
There are a few things. Actually, it's not going to be one thing. One of the things is that one, you have to exercise regularly. People tell me when they see me in my clinic that, oh, I do hard work. I work a lot during my regular day job. This is good, but there's a difference between hard work and exercising. When you're exercising, there's an hormone that is released in your body. It's called endorphin. It kind of like relaxes you. So this is a better way of exercising. And we recommend for you to exercise at least 30 to 40 minutes every day for 3 to 4 times a week. Yeah, absolutely.
Those were very good tips, Doctor. I appreciate you, and we're not going to let you go yet. We are going to be back live a couple more times with CHRISTUS Shoreline, but for now, we will be right back after this short break.